96.7 WCEI, thank you so much for waking up with us again this morning. We want to do a check-in again with Ken Kozel, CEO at University of Maryland, Shore Regional Health. Good morning, Ken. How are you today?
Doing fantastic, Matt. Good morning, and good morning to everybody out there.
Let's get an update on how things are going. Tell us what's happening at Shore Regional Health Hospitals as we continue dealing with COVID-19. I see there's a second modular building being put together on the employee parking lot at the Easton Hospital. I gather there are similar structures there or coming at least at Chestertown, Dorchester, and Queenstown?
Yes, Matt. The Easton construction project is really hard to miss because of its size.
Yeah.
You know, although these structures look like buildings, they're actually called advanced medical tents. We've had a total of 4 30 by 60-foot tents in place outside of our emergency departments for a few weeks now. And the larger one at Easton, which is 50 by 150 feet, should be ready in about 3 weeks. These are modular facilities with hard walls and floors. They're designed to function as hospital units, complete with nursing stations, a bathroom, heating and air conditioning, lighting, data drops, you name it, and a ramp for patient access.
Ken, where do the advanced medical tents come from, and who puts them together?
They're provided to hospitals across the state by the Maryland Emergency Management Agency and the Maryland Department of Health. And those tents are assembled by the crews from those agencies. You know, they're designed so that hospitals like us can use them. They're dispatched by those agencies for us when we're experiencing different kinds of emergencies that result in greater numbers of people needing hospital care.
Ken, are these expected to house COVID-19 patients? How many more beds do they add?
You know, as part of the University of Maryland Medical System, we've developed a robust and detailed surge plan that allows us to double our inpatient capacity and quadruple our ICU bed capacity among our 3 hospitals. But no, these tents are not planned to accommodate patients in treatment for the coronavirus. At the moment, the smaller tents that are already assembled are intended to function as triage tents for the emergency departments, providing space for staff to assess patients outside of the hospital in the event of a patient surge. You know, we're in the later stages of outfitting these tents with the proper equipment and supplies, and staffing plans are already in place if surge plans require us to activate those tents.
Is that true for the bigger tent at Easton as well?
No, the larger tent is being installed to meet the possible need to care for convalescent patients on our hospital campuses during a possible surge. I should say here that so far, Shore Regional Health is not seeing the level of agricultural-related cases that the lower shore is seeing. During the past 6 weeks, we have not been at or near capacity at any of our hospitals. But these tents help us be ready in the event that a surge presents itself.
Sure. I know. Going back just a second there, what did you mean, or what do you mean when you say convalescent patients?
You know, that's a great question, Matt. Many COVID-19 patients, once they recovered from the virus, no longer test positive for active disease, but they still need more care that can be provided than at home. Having a large tent as a convalescent unit will allow us to care for these patients on site if a possible surge create a greater demand for our inpatient beds.
Now, I see that we are in the midst of Hospital Week. COVID-19 must put a different spin on that. So how is Shore Regional Health observing Hospital Week with all this preparation for COVID-19 being top priority?
It sure is a different spin. And in fact, you know, instead of celebrating Nurses Week and Hospital Week, which actually overlap this year, hospitals are celebrating healthcare heroes to celebrate the contributions of all team members. So the idea is to highlight the contributions of those involved in direct patient care, but also those who support patient care. Team members working in our food service and environmental services departments, our lab and radiology teams, case management, facilities management, and security, patient access, and so on. We'll be highlighting the compassionate care and dedicated service of many healthcare heroes throughout the month on social media.
And Ken, of course, big in the news last week with the beaches being reopened and everything. And I saw people, doing posts on Facebook saying oh boy, people from the Western Shore coming to visit the beaches and they're bringing COVID. So what is your guys' response to that?
Matt, we recognize that as the state opens back up, it could potentially increase the risk of spread of COVID. But, in following the governor's guidelines and in ensuring that we continue to do the important things that we need to do to stay safe, we're going to mitigate that risk as much as possible. But even with that, Shore is prepared. We've got a great plan in place, and we're able to handle what comes our way. And we just look forward to keeping our community safe throughout this pandemic.
A big salute to you and, of course, all the medical professionals that are there on the front lines, still going strong. Thank you, as always, Ken. We'll be on the lookout for those stories that you mentioned, and we'll also chat again real soon.
Thank you, Matt. We appreciate the opportunity to be with you, and have a great day.
You as well. Ken Kozel, CEO, University of Maryland Shore Regional Health, with us on 96.7 WCEI. Good morning.